So I have a confession. When I first saw the headlines about another Medicare Advantage Stars lawsuit, my first reaction was, well, that is interesting. My second reaction was, I think we are asking the wrong questions. Most people immediately ask, who is going to win? Is Elevance going to win? Did CMS make the right decision? And those are fair questions, but they are also not the questions I'm interested in today's topic. Because regardless of how this lawsuit ultimately ends, I think it raises something much bigger and much deeper. I think it's going to force us to ask whether the environment surrounding Medicare Advantage star ratings is changing. And it's not changing necessarily due to measures, not necessarily the specification, but the environment executives have to operate in. And if that is true, then quality leaders need to start thinking differently. Not because the court told them to do so, but because the operating environment may be becoming more complex than it was even a few years ago. Well, that is what I'm going to talk about today. Let's get into it. Welcome back. My name is Peter Sa. In every episode, we explore why healthcare organizations, health plans lose value, not because the information doesn't exist, but because something breaks down between the provider encounter and the final submission. Today's episode is a little different. And this isn't a legal commentary. I'm not an attorney. And I'm certainly not here to predict how the court will rule. The court will ultimately decide the legal questions. My interest is different. What should Medicare Advantage executives be paying attention to right now? Because sometimes the most important lessons isn't the lawsuit itself. It is what the lawsuit tells us about the industry. Let me briefly level set. So earlier this year, a federal court ruled in favor of Clover Health on aspect of CMS 2026 star ratings methodology, leading to CMS to recalculate Clover's ratings. More recently, Elevance Health filed its own lawsuit arguing it should receive comparable treatment because it believes it was similarly affected. Elevance says applying the same recalculation will increase several contract ratings and restore the approximately $115 million in 2027 quality bonus payment. Whether that argument succeeds is for the court to decide. I'm much more interested in what this tells us as operators. And one of the questions is, are we entering a new era of Medicare Advantage governance? So for years, Medicare Advantage competition has largely centered around execution. Who could improve medication adherence? Who could increase preventive screenings? Who could engage providers more effectively? Who could retrieve charts faster? Who could close more care gaps? The execution was the competitive advantage, and frankly, it still is. But I think something else is beginning to emerge. The question isn't only about execution anymore. It is increasingly about methodology. It's about governance. It's about administrative consistency, how performance is evaluated. That is an important distinction because execution answers one question. And the question is, did we perform well? Right? On the other hand, governance asks another question. And the question is, what was the performance measured consistently? Right? Did we measure the performance consistently? Those are completely different conversations, and they belong in different boardrooms. Here is why I think this matters. So healthcare leaders spend enormous amount of time improving operational performance. They redesign workflows, invest in technology, hire clinicians, expand abstraction capacity, right? Even strengthen provider engagement. all with the expectation that better execution produces better outcomes. That is how the system is supposed to work. But when the methodology itself becomes the subject of litigation, executives naturally begin paying closer attention to the rules governing performance, not just the performance itself. I don't think that indicates something is broken. I think it is a sign the Medicare Advantage program has become strategically important enough that organizations are examining every aspect of it, including how success is measured. And honestly, that shouldn't surprise us. We are talking about star ratings. Star ratings influences quality bonus payments, right? It influences benefits, premium strategy, market competitiveness, member perception. This isn't an academic exercise. These are enterprise level decisions. So, healthcare has a unique ability to turn almost anything into an acronym. But this isn't really about acronyms, it's about governance. And governance rarely gets the same attention as operations until it changes outcomes. That is my first observation. I don't think quality leaders can afford to focus exclusively on execution anymore. They also need to understand the environment in which execution is evaluated, because increasingly both execution and governance matter. The second question that I think this brings up is, should quality leaders be paying more attention to policy than they did 5 years ago? You see, one of the things that I've been thinking about is how the role of quality executives continue to evolve. So 10 years ago, the conversation was largely operational. Can we improve medication adherence? Can we increase colorectal cancer screening? Can we retrieve enough medical evidence? Can we improve provider documentation? Those questions haven't disappeared at all. They are still fundamental. However, I think today's environment demands something more. Today's quality leaders also need to understand policy, not because they write regulations, but because regulations increasingly influence operational strategy. Think about how many executive decisions are made before the first chart is ever retrieved, right? I'm talking about staffing, technology investment, vendor selection, provider engagement strategies, clinical priorities, budget planning. You see, those decisions assume a certain regulatory environment. When that environment changes or it is challenged, it affects more than compliance. It affects planning. And good executives don't simply react to policy. They anticipate how policy may influence operations. That is why I don't think this is a legal story. I think it is a leadership story, because leadership isn't just responding to today's requirement. It is preparing the health plan, it is preparing the organization for tomorrow's environment. The third question that these lawsuits raises is, what should organizations do while the court decide? And this is probably the most practical question. And I think the answer is surprisingly simple. Don't change your operating discipline. If anything, strengthen it. Because regardless of how these cases are resolved, one thing hasn't changed. Organizations, health plans are still accountable for evidence they submit. They are still responsible for consistent abstraction. They are still responsible for quality assurance. They are still responsible for audit readiness. They are still responsible for ensuring the operational model is working. Those responsibilities haven't gone away. In fact, I would argue they are becoming even more important, because Periods of uncertainty have a way of exposing weak operating models. Organizations with disciplined processes tend to adapt more effectively. Organizations that rely on heroics or last minute recovery usually struggle. I've said this before on the on this channel. Trusted evidence isn't created during submission. It is created long before submission. It is created during retrieval, during abstraction, during quality review, during governance. Those fundamentals don't change because a lawsuit is filed. They are still the foundation of quality performance. Times I joke that healthcare has a habit of chasing the newest shiny object. 1 year it's predictive analytics. The next year is blockchain. Right, then it's AI. Now everyone is reading court filings. The headlines change, right? The operational discipline shouldn't, because while we are all paying attention to the latest development, patients, members are still receiving care. Providers are still documenting encounters. Abstractors are still reviewing records. Quality teams are still preparing submissions. The daily work continues. And that's where leaders create value, not by reacting to every headline, but by building the organization, ensuring that the organization is built to perform consistently regardless of the headline. So let me leave you with one final thought. I don't know how the Elevance lawsuit will end. I don't know whether other Medicare Advantage organizations will pursue similar legal challenges. And I don't know whether these cases will ultimately reshape STAR's program. Those questions belong to the court's room, right, as I stated earlier. But I do know this. The conversation surrounding Medicare Advantage quality is becoming broader. It is no longer only about closing gaps. It is about governance, about consistency, about transparency, about methodology, and executive decision making. That is worth paying attention to, not because it changes what quality leaders will do tomorrow morning, but because it may gradually change how they think about leading their health plan or their organizations over the next several years. So if you remember one thing from today's episode, let it be this. Don't focus on the lawsuit. Focus on what the lawsuit is telling us. Healthcare quality is becoming more interconnected. Operations, policy, governance, technology, evidence, they are no longer separate conversations. They are becoming one conversation. And I believe the health plans, the organizations that understand that earliest will be better prepared for whatever comes next. Well, thank you for joining me for another episode. If today's discussion gave you a different perspective on the evolving Medicare Advantage landscape, share it with someone on your quality team, on STARS, on compliance, clinical, operations, or even the executive leadership team in your organization. I would also love to hear your perspective on this. And the perspective that I would like to hear is whether you think these cases represent isolated legal disputes, or it is the beginning of a broader shift in how Medicare Advantage Stars will be challenged and governed in the time to come. Until next time, thanks for listening. Thank you for watching. I'll see you in the next one. Have a good one.